It has been a long time since I actually sit down and film a YouTube video, so struggling a little bit on how to start, but here we go. Hey, what's up everybody? Welcome back to my YouTube channel. It has been many weeks, yes, even months, since I actually sit down and film a YouTube video. If you follow me on social media, you know that it has been a very busy, crazy time. 2.5 weeks ago, I got married. I've been married. This is a story for another time. We eloped because of COVID in 2020. 2.5 weeks ago, we had our wedding celebration with both sides of our family so that we can come together and celebrate our marriage, and it was perfect. If you want to see more details on that, all the videos, pictures, there's a highlight reel on Instagram, so definitely check that out. The purpose of this video is to jump back into YouTube because I love doing YouTube. I feel like with my other social media outlets, like with TikTok and Instagram, I'm a little bit more limited in the length of time that I can spend explaining something. So having a permanent space on YouTube where I can keep those videos so people can reference back different topics, stuff like that. I love that. I love the space. So today, I'm finally going to be filming a video all about postpartum. This topic has been a long time coming. You guys know, if you've been following along, that I have done a separate YouTube video for all stages of pregnancy, first trimester, second trimester, third trimester, the process of labor and delivery, of induction, and now finally, thank you for all of your patience, but I'm going to sit down and film a video all about postpartum. I think it's taking me a while to film this video, one, because I was busy with my personal life, but two, I could literally talk about the postpartum period forever. There are so many changes, there's so much that's involved. So making a short YouTube video where I explain everything has been quite challenging. I have my notebook where I take notes. I'm actually even sitting here, let me lift this up, with a giant book. This is a book all about obstetrics and gynecology, a book that we use throughout residency, a book that I frequently reference for all things related to obstetrics. I'm gonna try and stay as organized as possible just to break this down for you all, to make it easier to follow and easier to understand. Realize that the postpartum period is challenging. It's almost not like a one size fits all because everything is going to be slightly different from woman to woman. Let's get started. Let's jump into a whole video talking about the postpartum period. Insert clip. Dun, 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 dun. Postpartum is a period of time following the delivery where pregnancy-induced maternal anatomy and physiological changes go back to a non-pregnant state. It's a critical time for the woman and her infant. It kind of sets the stage for long-term health and well-being. Keep in mind that the postpartum period is not a single encounter. It's not a single event. It is an ongoing process. If you were to compare two different women and ask them about their postpartum period, it's going to look significantly different. The way I've outlined this video for myself is going to be a little bit different, but I hope you guys can follow along. We're gonna talk about first the postpartum visit and what that means and when you should be seeing your doctor. Then I'm gonna jump into changes that we noticed with our bodies in the postpartum period. We're gonna go into details on all these changes you can see to your vagina, to the uterus, to the abdomen, to a whole slew of things. I'm also gonna talk about breastfeeding. We're gonna talk about postpartum blues, postpartum depression for a little bit. We'll talk about when is it okay to start having sex again. We are gonna go over a little bit of contraception and birth control. So there's a lot to cover. First and foremost, as just a recommendation, it's important to at least have some sort of contact with your OBGYN or the office in the first 3 weeks after delivery. Your official postpartum visit is typically going to be scheduled 4 to 6 weeks after the delivery. Now this may look different if you had a C-section, if your delivery was complicated in some way, but typically we see patients in the office 4 to 6 weeks after delivery. Postpartum visit is extremely important, so make sure you make that appointment and that you show up for the appointment. Recommendation is to at least be seen within the first 12 weeks. Ideally 4 to 6 weeks, we'll take 12 weeks. In the postpartum visit, we cover a wide range of topics. We want to make sure that physically, emotionally, psychosocially, you are doing okay. We want to talk about your mood, your emotions, your infant care, your feeding, your sexuality, contraception, timing of your next pregnancy. We want to cover it all. Also a great opportunity to optimize your health. Did you have a chronic condition that needs to be managed? High blood pressure, diabetes, thyroid disease, anything like that, we're going to cover at your postpartum visit. On top of that, we want to make sure and do a physical exam to make sure that you're healing well. Also want to make sure your pap smear is up to date. So it's a really important visit because we're going to cover everything. All right, now let's jump into some changes that your body is going to be experiencing and changes with your anatomy. First up, let's talk about the vagina. So after delivery, there are going to be some changes to your birth canal, but the human body is absolutely amazing. So during this postpartum period, you're going to notice changes with your vagina. Vagina actually starts to return to its normal state. There's going to be a diminishing size of the vagina to its pre-pregnancy state. Everyone's healing is going to be a little bit different because everyone might tear, some women don't tear, so that healing process is going to vary person to person. But essentially, the vagina is going to heal itself, and it does a really good job of healing itself. If you have any questions about vaginal tears or lacerations, I do have a video on that I'll leave linked down below. But essentially, depending on the laceration, this healing can look different. For some women, it could cause no issues. For other women, it can be very traumatic to the pelvic floor. If you're having pain with your pelvic floor or something doesn't feel right, you have to tell your OB at your follow-up visit. A lot of women benefit from pelvic floor physical therapy soon after delivery to either help with learning how to have your pelvic floor's muscles strengthen again, or if you're having pain, there's different techniques, exercises, or anything else that a pelvic floor physical therapist can help you during this time frame. Now let's talk about your uterus. When a woman is pregnant, the uterus grows all of these extra vessels to feed it because obviously you're feeding your baby and your uterus. And so soon after delivery, those giant vessels that we formed start to diminish and go back down to their normal pre-pregnancy size. I'm sure if you've had a baby, you know that in the postpartum period or soon after delivery, you go to your postpartum room and you look in the mirror and it looks like you still have a belly. That is your uterus. So after delivery, the uterus is working to contract down so that it can go back down to its pre-pregnancy size. This can take up to 8 weeks. So that act of the uterus contracting back in size, that is what's gonna cause after pains. Typically for women who deliver their first baby, meaning it was their first pregnancy, right after delivery, the uterus tends to just cramp down and stay that way. So it's always going to be tonically contracted down to try and go back to its normal pre-pregnancy size. For women who have had multiple babies, this can kind of come and go. So the uterus will contract down and then relax, and then contract down and relax. For some women, that motion of contractions can be just as painful as having a labor contraction. For others, it's just like a mild period cramp, so everyone's going to vary, but it is a normal side effect and a normal expectation after delivery. These symptoms of the uterus contracting down can actually be made worse by breastfeeding. That is because when we breastfeed, we release oxytocin, which oxytocin works in cramping down the uterus. So, and I know if you're a breastfeeding mom, you know exactly what I'm talking about and you're probably nodding your head. When we breastfeed, you'll notice the cramping get worse. That's what's happening. Other changes that you'll notice with the uterus and the vagina is that you'll have discharge. This discharge is very particular to the postpartum period and it's called lochia. Lochia is going to be a combination of things. This type of discharge has decidua in it, which is a layer that coats the uterus during pregnancy, so that layer is shed off. It's going to have blood in it, it's going to have epithelial cells, bacteria, mucus, and it typically appears as like a yellow, white, maybe there's blood in it, so maybe a little red and pink. It is a vaginal discharge and it happens to everyone after delivery, whether it was a C-section or vaginal delivery. Urinary symptoms. Typically right after delivery, we don't see very many urinary problems, but they can definitely present later on. So if you start to develop any urinary symptoms, whether it's urinary retention or you're having problems urinating or you don't feel the urge to go to the bathroom, or maybe you're leaking urine. We need to know about it. We're your OBGYNs and we can help you. Next up, changes to your abdominal wall. So we know during pregnancy that the skin and the muscles of the abdominal wall become stretched because of the growing uterus and baby. We know that because of this, the elastin fibers of the skin can rupture, and so after delivery, the skin is usually a lot more soft and it's a little bit stretchy. The best things to help with this is going to be the use of an abdominal binder after delivery. Again, whether it's C-section or a vaginal delivery. Exercise will also help with this, but keep in mind that this process is not immediate. This can take several weeks. So let's stop with all of the comparison, looking at these celebrities and models that are back on the runway soon after delivery. It's not normal, and I hate that that is something that has just become culturally accepted. No, I'm done. I could rant on that forever, but keep in mind that this is going to take several weeks. Some women may also suffer from diastasis recti, which is when the rectus abdominal muscles start to separate. Typically, we can see this in pregnancy, and there's no treatment in pregnancy. After pregnancy, a lot of the treatment is going to be focusing on core strengthening. So again, getting a referral or going to see a physical therapist may help with this. Now in the postpartum period, there's also going to be changes to our blood volume. The minute we become pregnant, there's changes to blood volume. So the minute after we deliver, there's also going to be changes to our blood volume. It takes about a week for all of our blood volume to go back to its pre-pregnancy state. So you may notice that after delivery, you feel like you have to pee a lot. And you're probably right. That just means you are getting rid of all that extra fluid. Now, if you were someone that were diagnosed with preeclampsia in pregnancy, this may not always be true because patients with preeclampsia tend to retain that fluid, which is what eventually causes that really bad swelling. Again, it may look different from patient to patient, but do expect at some point to pee a lot because you're peeing off all that extra fluid. Now let's talk about breast changes and breastfeeding. We know, and I hope you know, that breastfeeding is extremely difficult. It is, especially for new moms, although it's going to vary pregnancy to pregnancy as well. Breastfeeding is challenging. Especially if you're a new mom, it is something you have never done, and it is something the baby or newborn has never done. So it's going to be a learning curve for both of you. Milk letdown is going to be different for everybody. For some women, their colostrum of that first early milk or their milk letdown can come very quickly after delivery. For some women, it can take about a week. The biggest thing to keep in mind here is continued stimulation, whether that's by having the infant latch on to the nipple, doing a handheld pump, doing any sort of pump where you are stimulating the nipple is going to be beneficial. For a mature milk letdown, this can take 4 to 6 weeks for that mature milk to come down. Now I can 100% make an entire video about breastfeeding and its benefits and all of that, but keep in mind, this is my philosophy and what I talk to my patients about. While there's so many great benefits with nutrition, with mood, with infant maternal bonding, all of these great benefits to breastfeeding, also keep in mind that I know this can be such a difficult thing to do. So I always tell my moms that fed is best. Whether you're going to be breastfeeding or formula feeding, it is okay. Fed is best. I don't ever want to shame anyone into breastfeeding, into not breastfeeding. It is completely up to you and what is going to work best for you, for your mental health, for your emotional health, sometimes even for your economic health, for your job. Whatever is going to work for you and your infant, that is up to you and your infant. No one else needs to be telling you exactly what to do or what you're doing wrong or what supplement you need to take to make things easier. Because at the end of the day, every single human body is different. And just because something worked for someone doesn't mean it's going to work with you and your infant. Don't shame yourself. You're doing an amazing job. Just hang in there. So now I want to talk about some tips, some things you want to keep in mind for soon after delivery. First and foremost, soon after delivery, eat whatever you want and walk. Whether you had a vaginal delivery or C-section, we know that early ambulation helps. So as soon as you can, get up out of that hospital bed and walk around your room, walk the halls if you're able to, and eat. I know there must have been a lot of things in pregnancy that either you didn't tolerate or couldn't eat, so eat what you want. You deserve it. For vaginal health, and again, this could be for someone who had a C-section, it is sometimes common to have vaginal pains even if you did have a C-section. You carried a baby for 40 weeks, and that's a lot of pressure and a lot of weight that is sitting on the pelvic floor and the vagina. So do ice packs. That's gonna help with the swelling and any sort of discomfort. The Dermaplast or that numbing spray, that's gonna be your best friend. Sitz baths, also a good idea, and it helps with healing. Your vaginal pain or your perineal pain should get better day to day. If it's not getting better, that means something may be wrong, or maybe you're forming a hematoma. So if the pain is not getting any better, you need to let us know. Now I briefly want to talk about postpartum blues, postpartum depression, and I said brief because again, this is a topic that we can definitely talk about for a very long time. So if you do want more information, I do have an entire blog post that I've written in Spanish and in English all about postpartum depression. I'm gonna leave that linked down below. But briefly, let's talk about postpartum blues. Postpartum blues is extremely common and almost every single woman goes through this. Typically is short-lived and can last anywhere from 2 to 10 days after the delivery. This is going to be filled with a bunch of emotions. So almost like an emotional roller coaster. It can lead to things like anxiety, crying, feelings of overwhelming joy, but also panic. It can also lead to a little bit of body image issues, but again, it's typically short-lived, doesn't extend for more than 10 days. Your body is going through a lot. You have this new beautiful baby to take care of and to raise, and that's exciting, but it's also really scary. So having these postpartum blues, extremely common. Like I mentioned, I have a lot more details on postpartum depression on the blog post, but like I said, postpartum blues, short-lived, 10 days. Postpartum depression, it lasts longer and the symptoms linger. At your postpartum visit, your doctor should be asking about your mental health, your mood, and how you're doing. How you're coping with a new baby, who's helping you at home, do you feel overwhelmed? How can we best help you? We are there to listen to you, and if you feel like your doctor is not there to listen to you, you need to find a new doctor, or you need to find someone else that will take your feelings for valid, because they are valid. That is how you feel, and someone should be helping you. So at that same postpartum visit, it's also an amazing opportunity to talk about contraception or birth control. Now ACOG, the American College of OBGYNs, recommends that the space in between pregnancies be anywhere from 18 to 24 months. That gives you and your body time to heal. So it's a great opportunity to have the conversation on birth control. It's also a great time to sit down and figure out timing in between pregnancies. Do you want to get pregnant again right away? Do you want to wait 2 years, 3 years, 4 years? Have this conversation with your doctor, and then we can figure out what kind of birth control, or maybe no birth control, is going to be the best option for you. The return of your period. How long does it take? When will you get ovulation back? All those good questions. So again, this is going to look different for everybody, especially if you're breastfeeding. When you're breastfeeding, ovulation is typically suppressed, meaning that you don't ovulate, but that's not always true. So it's not a reliable form of birth control. Typically, the return of menses can be seen about 6 to 8 weeks after delivery. If you're not breastfeeding, ovulation can occur as early as 5 weeks after delivery, but anywhere between 5 to 11 weeks. So can you get pregnant 5 weeks after? Yes, you can. So if you're going to be sexually active and you're not currently on birth control and you just gave birth, you need to use protection, or you need to wait before your postpartum visit to kind of talk things out with your doctor. If you are breastfeeding, keep in mind that you want to avoid birth control that has estrogen in it, as we know that estrogen can occasionally slow down your milk supply. So have this conversation with your doctor. Now let's talk about sex. When is it okay to have sex after delivery, or what should you do? I get this question all of the time. A lot of this is going to be dependent on your comfort and your desire. A lot of women after they deliver, the last thing they want to do is have sex. And that makes sense. Most women, especially after a first delivery, will have some sort of vaginal tear. So it's important to wait to have intercourse until you can be cleared by your doctor that your laceration has been healed and that it's okay. Now, the postpartum period is what we call a state of low estrogen. After delivery, your estrogen begins to decline. Lower estrogen level does actually affect your vaginal tissue. When less estrogen is around, it makes the epithelium or the tissue inside of the vagina very thin. So that first intercourse that you have after delivery may be more painful because of that thin vaginal layer. So make sure you use lube the first time you have intercourse after you deliver. You can also see this thinner vaginal tissue for women who are breastfeeding, so keep that in mind. So in a study that was done in the year 2000, it demonstrated that about 90% of women were back to having intercourse at about the 6-month mark. And everyone's going to be very different, so keep that in mind. If you are scared to have sex again, or it's extremely painful, or you simply just don't have the desire and it's causing some sort of stress in your marriage, I encourage you to reach out to your doctor and figure out maybe there's something else that's going on that is affecting that low desire or low libido. Okay, I think that's where I'm gonna wrap up this postpartum video. I realize that it's kind of all over the place, but again, I tried my best to organize myself throughout this video to make it easier for you to follow. I hope you found it very beneficial and that you learned something new, or maybe it gives you encouragement to call up your doctor and make an appointment to sit down and talk more about this postpartum period or changes that you're having. I mentioned earlier in the video, the postpartum visit or the postpartum appointment is so important. Please go to your appointments. We love to see you and we want to make sure that you're doing okay, and we want to help in any way that we can. Thank you so much, first of all, for your patience on my YouTube videos, but I am wanting to get back in the swing of things, so you can expect more videos from me this year and next year. I'm very excited to keep filming. As always, I will leave links down below to my Instagram, my TikTok, and my blog, which I write in Spanish and in English. All 3 of those are great sources of information, and obviously over on my Instagram you can find more day-to-day content. Yes, it's some medicine stuff, but also just my life as an OBGYN, as a newlywed, and all that fun stuff. I hope you guys learned something new. Please leave me any questions down below, or maybe topic ideas and other videos that you all want me to film. Remember to always be kind and show love to everyone around you. I love you guys so much. Thank you so much for your continued support, and I will see you in my next video. I love you guys. Have a good day. Bye. This actually took me forever to film because I was trying to get organized as best as I could. Love you guys.